Good morning. Thank you for starting your day with Good Day Charlotte.
Coming up for us, vaping illnesses are spreading across the country. Hey, Dr. Matthews is here. We're going to talk to her and give you advice on how to talk to your kids about vaping. Welcome back, everyone, into Good Day Charlotte here on Fox 46. So listen, this is new information. President Donald Trump now backing off of a ban on flavored vaping products. According to the White House and campaign officials, he's worried the ban could alienate voters. Officials had been working for months to try and stop the youth vaping epidemic that experts feared was impacting millions of teens, and it is still unclear what will happen to the plan now. Almost every week we report on a new warning or an illness related to vaping. This morning we've got Dr. Deb Matthew here to talk about the seriousness of vaping in our community. It's always nice to have you here.
Yeah, it's good to be back.
Yeah, I wish this was something we were celebrating instead of saying this is real. It should scare the crap out of parents out there and teenagers. What's the problem? Why is it so bad?
Yeah, so in the last 2 years, the incidence of teen vaping has doubled. 5 million kids in America are vaping. And a recent poll showed that 1 in 4 12th graders, 1 in 5 10th graders, and 1 in 8 8th graders is vaping. And you know, what we're finding, though, is that kids are getting sick with these really serious diseases, and these are previously perfectly healthy young people, mostly under the age of 24, and mostly men, mostly young boys, actually.
What is making this so attractive to teenagers? Because if you were to ask middle schoolers, here, smoke a pack of cigarettes, oh, no, I'm not going to do that. What is it about this?
Smoking, really, the incidence of smoking has gone down. That's a good thing, but vaping is trendy. Those pods are cool. They're colorful. So, you know, it's the thing these days, but it's really scary because kids are dying.
Okay, and so what do we do about it?
So far in North Carolina, there have been 61 cases of this vaping-related illness. The youngest was 13 years old.
My gosh.
And what we know about it is that it seems to be mostly when kids are vaping marijuana products, THC, the active ingredient in marijuana. So, and also it is mostly bootlegged THC products. So in North Carolina, of course, THC is not legal. We can't go to a dispensary to get it. But 1 in 10 North Carolina teenagers reports having vaped THC.
We had a story not too long ago about a 17-year-old who had a double lung transplant. What does a vaping illness look like?
Yeah, so you can, respiratory symptoms, so cough, trouble breathing, chest pain, you can have vomiting and diarrhea, you can have fever, and looks an awful lot, or sounds an awful lot like the flu, doesn't it? It's hard, there's no test for doctors to be able to go in and test you for it. Looks like pneumonia. So it's important if you get sick, you need to be upfront and let people know that you have been vaping, especially if you've vaped a THC product.
So we're hearing about an ingredient called vitamin E acetate. Is that the chemical that's linking all these illnesses together? Well, like, what's it doing? What's it doing to our lungs?
So we're not sure exactly, but so far what we believe is that this vitamin E acetate, which is a vitamin E, a synthetic kind of vitamin E, is used to dilute THC in some of these bootlegged products. And it's greasy. So vitamin E is good for you in your vegetables. It's okay if you take it as a vitamin pill or rub it on your skin, but when you inhale it, it damages your lungs.
And this is not something that you could take. I mean, once you've damaged your lung, that's not something that you can fix and repair, is it?
We don't really have a lot of information. This is all happening so fast.
This is scary.
This is really scary.
Okay, so what do we do? Because if you've ever looked at, Juul is kind of the leading company that's been in the news, and we've had a lot of stories on it. There's a lot of different vaping pens that are out there, but it's hard to know. That's what a Juul looks like. It almost looks like a USB, like a thumb drive. And so it's hard for a lot of parents out there, Dr. Matthews, to even recognize if you were to see it, and then how to approach your kids about it. It's kind of intimidating.
It is kind of intimidating, but you know, it's really important to talk about. When you are vaping, you are playing Russian roulette with your life at this point because there's a lot of unanswered, questions, and people are dying.
I spoke with a local resource officer in Union County, and he was saying it is so, not only is it trendy, which you mentioned, but it's the problem. And parents, I want to give you this advice, and teenagers may not want you to know this, but he even said teenagers are wearing hoodies year-round, even in the summertime, or, when it's warmer, because you don't see the smoke. It's a vapor. And so they're smoking it in class. You don't smell it. You don't see it. They're smoking out of one sleeve. They blow it down the other sleeve, and this is happening all across schools, all around our area. So parents, you got to have these conversations. You got to open the door. You got to look through their book bags and stop saying, well, it's their it's privacy. I'm worried about it. This is huge. And every week we've got a new story, Dr. Matthews, about teenagers and middle schoolers who can't breathe, and it's getting worse.
It's really scary. And you know, if your kid or if you start to get sick, what you need to do is, first of all, go to your doctor. Be honest if you've been vaping. You can call Poison Control for more advice. For some people, if they've been using vaping in order to try to quit smoking, we don't want you to go back to cigarettes. Cigarettes are still bad for you, but you could go back to your doctor and look for, you know, other smoking cessation means instead.
All right, well, there we go. Start the conversation. Thanks for kind of opening our eyes to the severity of the vaping that's out there, Dr. Matthews. We appreciate it. All right, 726 Paige, we're going to send it back to you.